All right, we are talking back to school in the Health Watch this morning as there's concern about parents when it comes to COVID, monkeypox, routine vaccinations. So a lot to get to. Happy to be joined once again by Dr. Syed Hussain from Trinity Health of New England, as we are every week, but this time on a Friday.
Morning.
Good to see you again.
Thank you.
All right, before we talk about just sort of the routine school, back to school vaccinations, let's talk about the updated COVID vaccines, these bivalent ones coming in. What does that mean? We've been talking about it, but I don't think people know.
Sure. A lot of developments coming up in the next week to 10 days, Tim. This is very, very exciting. We've seen the UK, for instance, that already gave approval to Pfizer for their new reformulated vaccine for COVID-19. What basically Pfizer and Moderna have done is they've submitted data and an application for emergency use authorization for a new vaccine, which combines both protection against the original strain of COVID-19, but also the Omicron subvariants that have gained ground in the country, BA4 and BA5. And so it's a bivalent vaccine, which will help us prepare for a possible fall surge.
Sure. And here's hoping it tamps things down in the meantime. How about vaccination schedules, even for college students? What do parents need to know about that?
Sure. So if they've completed 2 of the original vaccine series for either Pfizer or Moderna, it's been 5 months or more, you are eligible for the first booster. The second booster shot is only allowed right now for those that are above the age of 50 or 12 and above with an immunocompromised condition. That's what parents need to know. And then, of course, the CDC's Advisory Committee on Immunization Practices meets September 1st. This usually follows an FDA approval of the vaccines, which we expect to happen. And so there'll be more recommendations from the CDC in terms of who will be eligible for the new booster that we expect to get approved.
And in terms of COVID exposures, the CDC has now changed its guidelines, relaxing them somewhat. Why don't you tell us about that?
This is terrific. It just is a CDC nod that we have to coexist with this virus. We have to live with this virus. The biggest change the CDC has made is dropping quarantine requirements. So regardless of vaccination status, if you've been exposed, you do not need to quarantine any longer. If you're asymptomatic, you need to wear a mask for 10 days. CDC does recommend you get tested on day 5. And if you're symptomatic, then it's a different route you need to take. But this is big because it will help school children remain in school. We know how disruptive the last couple of years have been for learning.
We were, right? And there was always a big battle between that and the people on the sides of, well, we need to take more precautions. I think they were never okay with the learning loss and the disruptions. It was just something that was the lesser of two evils. So this is good news that we're able to try to ameliorate those problems. So test to stay, that looks like that's probably going by the wayside as well.
All of those are going away. Cohorting, social distancing, test to stay, all these things that were disruptive. We saw children just being sent home because there was exposure. All of that will be a thing of the past as we learn to coexist with this virus.
And lastly, monkeypox. It looks like that's not going to require any great shakes in a classroom setting to try to minimize.
The bottom line is we need to continue to track cases in our communities, and if you take basic hygienic precautions, those should suffice. If parents should know if there is an exposure that they're aware of, or if a child develops any rash or anything, then please contact their primary care doctor.
Yeah, and I was telling Dr. Hussain before, I looked at it a lot the same way as we look at how to prevent West Nile virus. You don't really need to do anything above and beyond what you would normally do to protect against mosquito bites anyways. Just that good hygiene, hand washing, surface disinfecting. It looks like you should be good to go. So whenever we can give you guys a reason to say don't worry too much, we want to do it because, you know, that's just, why not? We've got enough to worry about in our lives. Doctor, thank you so much for joining us again. This time on a Friday. He does it every week. Dr. Syed Hussain from Trinity Health of New England.